Hello students, this video is my continuation of the blood vessels of the true pelvis. Okay, in my previous video I talked in detail about the internal iliac artery, its origin, its course, and also about the branches of the internal iliac artery. Okay, so I've talked about it in detail. Now we'll talk in this video the detailing of each and every branch which is arising from the internal iliac artery. So the origin, if you remember, it was just as a internal iliac. It begins as the terminal branch of common iliac in front of SI joint at the level of fifth lumbar vertebrae and sacrum. Okay, so this internal iliac, it begins at this level. Okay, then it runs down, it reaches the greater sciatic foramen where it divides into anterior and posterior trunk. Anterior trunk, it supplies both the visceral and the parietal branches. Okay, and posterior trunk, it gives out only parietal branches. So I have mentioned these branches in my previous video. Okay, now we'll go in detail about each and every branch. The first branch we'll talk about is the branches of the anterior trunk. Okay, so we'll talk about the description of the branches of the anterior trunk. Okay, so here the division of the internal iliac artery, the branches, it was in the form of arising from the anterior trunk, arising from the posterior trunk, and the terminal branches. And the alternate classification, or the other way in which you can classify in a different way, is the parietal branches and the visceral branches. So the parietal branches arising from the anterior trunk and posterior trunk, visceral branches which are only arising from the anterior trunk. Okay, this is the other classification. So for descriptive purposes, okay, for description we'll take visceral branches. So description of branches of the anterior trunk. So the visceral branches of the internal iliac, the visceral branches, this all branches, it arises from the anterior trunk. So this is, suppose, parietal branches, this is visceral branches. The visceral branches is arising only from the anterior trunk, and the parietal branches is arising from both anterior and posterior trunk. Okay, so for descriptive purposes we'll take this classification. Okay, so first we'll take the visceral branches. Okay, the visceral branches of the anterior trunk. Okay, now first visceral branch is the superior vesical artery. Okay, so this is a branch of the anterior trunk and it's a visceral branch. Okay, so visceral branch means it's supplying the viscera organ. The superior vesical artery, it runs forward and medially to supply the upper part of the urinary bladder. So it runs forwards and medially to supply the upper part of the urinary bladder. So if you remember this diagram which I have taught you here in my previous video, this is the common iliac, this is the internal iliac, this is the external iliac. So right now we are talking about only the internal iliac, because external iliac, I have told you that it ends, it gives a branch which is known as inferior epigastric artery, and it will hook around the ductus deferens. Okay, it will hook around the ductus deferens and it will reach the anterior abdominal wall. So that was the single branch which was arising from the lower end of the external iliac artery, that is the inferior epigastric artery. So here we are talking about only the internal iliac artery, that is the main blood vessel supplying the true pelvis. Now internal iliac artery, first we are talking about, this is the anterior trunk, as you all know, this is the posterior trunk, and from the anterior trunk arises one artery which is the superior vesical artery. So this is the anterior trunk. So you can see here, this is the anterior trunk. Yes, this is the anterior trunk, and from here arises the superior vesical artery. Okay, this is the superior vesical artery. Now this is the urinary bladder. Yes, you can see this is the urinary bladder. So it is supplying the upper part or upper surface of the urinary bladder. So this is the anterior trunk of the internal iliac artery. It gives one branch, superior vesical artery, which is supplying the upper part of the urinary bladder. Okay, so this is the superior vesical artery. The artery is crossed by ductus deferens and gives a branch to it. It also gives a few twigs to the ureter. Okay, so the artery is crossed by ductus deferens. You can see this ductus deferens and its artery. So the artery is crossed by ductus. This is seminal vesicles. Okay, and this is the deep inguinal ring. This is the ductus deferens. So the artery is crossed by the ductus deferens. You can see here, this is the superior vesical artery. So it is crossed by the ductus deferens. So it will supply the ductus deferens as well as, okay, you can see this is supplying the ductus deferens, and it will supply some part of the ureters. Okay, it will supply some part of the ureters. You can see here, this is the ureter. This is the ureter. This is the urinary bladder. Okay, so this superior vesical artery will supply the ureter because it is crossed by the ureter. Okay, and it will also supply the ductus deferens in males. Okay, as ductus deferens is crossed. Yes, you can see here, this is the anterior trunk, internal iliac, superior vesicle. It is crossed by ureters. It will supply the ureters some part. It is crossed by ductus deferens. Okay, in males. So it will supply, some branches will supply the ductus deferens as well as it will supply the upper part of the urinary bladder. Clear? This is superior vesicle. The stem of the artery represents the proximal part of the umbilical artery of the fetus. It is continuous with the medial umbilical ligament that represents the obliterate part of the umbilical artery. So what they are saying is it has embryological origin. The superior vesical artery has embryological origin. The stem of the artery represents the proximal part of the umbilical artery of the fetus. So the proximal part of the umbilical artery, you can see here, this is the obliterated umbilical artery. So the stem, okay, of the superior vesical artery. This is the superior vesical artery. So the stem, it's an obliterated part of the umbilical artery. The stem represents the obliterated part of the umbilical artery. You know about the fetal circulation, there is normally two umbilical artery, one umbilical vein. The umbilical cord is cut. So the superior vesical artery, it represents one of the obliterated umbilical artery, the stem. Okay. It is continuous with the medial umbilical ligament that represents the obliterated part of the umbilical artery. Okay. So the umbilical artery, one of the part, there is two umbilical arteries. So one part, it is represented as superior vesical artery and the other part is the medial umbilical artery. The superior vesical artery is present in the pelvic area and the medial umbilical artery, it forms the part of the anterior abdominal wall. So it's a remnant of the umbilical arteries. Okay. So the anterior trunk, the visceral branch, first is the superior vesical artery. It arises from the anterior trunk. Okay. It runs forward and is supplying the upper part of the urinary bladder. So it is supplying the upper part of the urinary bladder, the superior vesical artery. Okay. While passing, it is crossed by ureters, so it gives some branches, twigs to the ureters. Also it is crossed by the ductus deferens in males. Okay, so it gives branches to ductus deferens. The stem is an representation of obliterated umbilical artery. Okay, so and it is supplying mainly the upper part of the urinary bladder. Okay, so this was about the superior vesical artery. Vesicle means bladder. The next artery from the anterior trunk, visceral branch, is the inferior vesical artery. Inferior vesical artery is present only in the males. It runs forwards and medially to supply the urinary bladder. the prostate, the seminal vesicle, and the lower end of the ureters. Okay. So, if you see, the upper end of the ureter is supplied by the superior vesical artery. Yes. Now, from the anterior trunk, see, one artery arises. This is the superior vesical artery. Here is the inferior vesical artery. It is going down, okay, and if you see, it is supplying this inferior vesical artery. It is supplying the lower part of the ureters, okay. It is supplying the urinary bladder. It is supplying the urinary bladder. It is supplying, this inferior vesical artery is giving branches to the seminal vesicles, and it is also supplying the prostate. Yes, it is very clear in the diagram. So, internal iliac, from the anterior trunk, see, arises inferior vesical artery. It is going down. It gives branches to the lower part of the ureter, because upper part is from the superior vesicle. Then it is giving branch to the seminal vesicles, okay, inferior vesicle. Then it is giving branch to the lower part of the urinary bladder. Upper part is superior vesical artery, and it is giving branch to the prostate. Okay. So, inferior vesicle, lower half of the ureter, seminal vesicles in males, prostate in males obviously, and the lower part of the urinary bladder. This inferior vesical artery is only present in males. Okay, it is present in males. Now, in female, the inferior vesical artery is replaced by the vaginal artery that supplies the vagina, urinary bladder, and part of the rectum. So, in females, instead of inferior vesical artery, the anterior trunk gives vaginal artery, and vaginal artery will supply the vagina, the urinary bladder, and the part of the rectum. Okay. The branches anastomose with the branches of the uterine artery in the medial line in front and back of the vagina, forming the anterior and posterior azygous arteries of the vagina. So, this vaginal artery, okay, it anastomoses with the uterine artery. The branches of vaginal artery will anastomoses with the uterine artery. Okay, it will anastomoses with the uterine artery at the back of the vagina in the median plane, and it forms anterior and posterior azygous arteries of the vagina. So, the vaginal artery branches and the uterine artery branches, okay, they anastomoses on the back of the vagina, okay, and in the median line in front, and it will form the anterior and posterior azygous arteries of vagina. Okay, so this you have to remember. So this was about the inferior vesical artery or vaginal artery in females. This is about the inferior vesical artery. Okay, so this is about the inferior vesical artery. Clear? Inferior vesical artery present only in males, okay, and it supplies the urinary bladder, prostate, seminal vesicle, and the lower end of the urethra. Females, it is known as vaginal artery. Okay. Next thing, we'll talk the anterior trunk. The visceral branch is the middle rectal artery. It runs medially to reach the rectum, where it anastomoses with the superior and inferior rectal arteries. Apart from the rectum, it supplies the bladder, the seminal vesicles, and the prostate. So, you can see here the middle rectal artery. Okay, so the middle rectal artery, it's a branch of the anterior trunk, visceral branch of the anterior trunk of the internal iliac. So, this is your middle rectal artery. You can see here, this is the common iliac. Yes, this is the external iliac, this is the internal iliac. So, it is dividing into anterior trunk and the posterior trunk. Okay, so from the anterior trunk, there is one branch arising which is the middle rectal artery. Yes, you can see here very nicely. So, this is the internal iliac, this is the posterior trunk, this is the anterior trunk, and from the anterior trunk arises the middle rectal artery here. Yes, so what does this middle rectal artery doing? It is supplying the rectum the bladder, and the seminal vesicles and prostate. So this supply you have to remember. Okay, and it anastomosis with the superior and inferior rectal arteries. Okay, so middle rectal arteries is anastomosing with the superior and inferior rectal arteries, and it will supply the rectum, the bladder, rectal arteries. So obviously it will supply the rectum, the bladder, the seminal vesicles and the prostate. So seminal vesicles and prostate in males. Next artery is the uterine artery. Now you know uterine artery, it anastomoses with the vaginal artery, and it forms anterior and posterior azygous arteries of vagina. It is anastomosing in front and back of the vagina. So that's why it is known as anterior and posterior azygous arteries of the vagina. Okay. Now the uterine artery is present in the female only, obviously, and it runs medially on the pelvic floor, which is formed by levator ani. So if you see this diagram, this is the uterine cavity, this is the uterus, okay, this is the uterine tubes, this is the ovarian artery, this is the ovaries, okay. Now this is the internal iliac. This you can see this is the uterine artery, okay, this is the uterine artery. This is your pelvic diaphragm, which consists of levator ani, vagina and its lateral fornix. Okay. So these are the uterine tubes, and this is the ovarian artery. So what they are saying is the uterine artery is present in the female only, and it runs medially on the pelvic floor, levator ani. So it is running medially. This is levator ani, so it is running medially on the pelvic floor. Okay, it is running medially on the pelvic floor, this uterine artery. Okay, on the pelvic floor. Okay, lateral to the pelvic part of the ureter. Okay, and it reached the lateral side of the upper end of the vagina. So it is reaching the, so it is going this way from the medially on the pelvic floor. It is going this way, then it will go to the lateral part of the vagina. Okay, this is going to the lateral part of the vagina. Okay, and it will reach the lateral vaginal fornix. This is the fornix. So it is going to the lateral vaginal fornix. You can see the branches going to the lateral vaginal fornix. Okay, here the artery crosses above the ureter from lateral to medial side and then passes upward alongside the side of the uterus. So this artery is here, it is crossed by the ureters. Okay, it is crossed by the ureters. Okay, and it will go above and it will run along the side of the uterus. So you can see it is running along the side of the uterus. This is the uterine artery, this is the uterus. So it is running along the side of the uterus. Okay, now it is running within the two layers of the broad ligament to reach the junction of the uterus with the uterine tubes. So it is running between the two layers of the broad ligament. You know where is the broad ligament here, and then it will cross and it will reach the uterine tubes. Okay, it will reach the uterine tubes. It enters the mesovarium to reach the hilum of the ovary. So it will reach the hilum of the ovaries. So this is the uterine artery. Okay, where it anastomoses with the ovarian artery. So here is the ovarian artery and here is the uterine artery. So here is the anastomosis of the uterine and the ovarian artery. The uterine artery will supply obviously the uterus, the uterine tubes, the ovaries, the urinary bladder, the terminal part of the ureters and also the vagina. Okay, so again I will repeat, the uterine artery, okay, I am talking about the uterine artery, is present only in females and it runs medially on the pelvic floor, okay, formed by the levator ani. It is running medially. Okay, it is lateral to the pelvic part of the ureters to reach the lateral side of the upper end of the vagina. Okay, that is the lateral vaginal fornix. Here it will reach here and it will supply this lateral vaginal fornix. Here the artery crosses above the ureters. Here would be the ureters, and it runs from lateral to medial side. So from laterally it is coming to medial side and it then passes upward along the side of the uterus. So from lateral it is going to medial, and from when it is going from lateral to medial, it is crossed by the ureters and it supplies the lateral vaginal fornix. It is supplying the lateral vaginal fornix, and it is going within the two layers of the broad ligament, okay, and it will reach the junction of the uterus within the uterine tube, and it runs laterally. So from lateral again to medial, and then it is going laterally, okay. It is running laterally below the uterine tube, okay, below the uterine tube. It enters the mesovarium to reach the hilum of the ovary, where it anastomoses with the ovarian artery. So here it, as it passes from lateral to medial and then laterally, it is supplying the uterus, the uterine tubes, okay, supplying the ovaries. So uterus, uterine tubes, ovaries, the urinary bladder, the terminal part of the ureters, and also the vagina. So this was about the description of branches of anterior trunk, the visceral branches. Okay, the next branches I'll take in my next video. Thank you, students.